So the most important elements to be able to capture under the new NCD are number one, CO2. So CO2 up front, and then there's also lots of wording around improvements of CO2. Now, if you read these documents, you've got to look at whether or not it's an and or an or. And so what that means is if there's a list and you're looking at an NCD for the first time, or you don't have much experience with this, when you're looking at that list, if it says CO2 and something else, then they're both required. If it says or, then you got to have one or the other. So if you start to break down the continued coverage, the upfront qualification, all those things, you got to look at the ands and the ors. And so you got to make sure that you have the CO2, that you rule out sleep apnea, and then there's a variety of other things on a list that you have to follow. And one of those things that is new is they don't want the patient to have had new symptoms or to have had new medications in the last 2 weeks. And this is new, but the reason is because if you go to the doc and you're having symptoms and now all of a sudden we throw a bunch of stuff at you, then you don't really know what worked. Now, I don't like this clause because it's going to make it operationally very, very difficult to try to manage how do we get those patients on. And now it's up to you as a DME provider to start to look into some of these clinical things that we haven't had to in the past, right? So you've got to now know, have they added new medications? Have they had new symptoms? Or you're going to have to get the doc to write that they haven't in the last 2 weeks. And so the documentation on an ongoing basis is obviously, as I've mentioned many times, is the compliance piece. But when it comes to testing and results and data, it's really about tracking symptoms. That's something that we've not had to do before. So looking at reductions in headaches, reductions in hypercapnia symptoms, morning fog, those types of things. Or it's looking at improvements in CO2. So if you look at those ors in there, then the ongoing documentation, there's some requirements around whether you can document a CO2, or if you don't have a CO2, there's a way to do that with symptoms. Either way, you got to have a way to be able to track that long term and to have a way to document all of those clinical values.